Hello, I'm Dr. David Mickel and welcome to the Mickel Therapy website. Just like to tell you a little bit about the process of Mickel Therapy, how it's evolved over the last 12-13 years, and I hope you enjoy having a look around our website. Well, first of all, I based the whole conditions of CFS M.E fibromyalgia on a condition involving the hypothalamus, as you'll be able to see in the other video. Initially this was very metaphorical. We used to split the head from our body, which of course is ridiculous because they're connected, absolutely connected. And so we started to come up with a more scientific model of the whole process of A, what makes us unwell, and B, why Mickel therapy appeared to be working so well. The first step in this was really to start to understand at a very amateur level, of course, the neurological functioning of the brain, which is extremely complex. So while the hypothalamus is definitely involved, there has got to be more to it. And this is probably all centred around the core emotional midbrain, whereby people who get chronic fatigue syndrome, ME fibromyalgia, appear to have extremely sensitive core emotional midbrains. Now these produce emotions that are not created by thought. So there are two branches of psychology basically. One that says that what we think creates how we feel, and the other one, which is, from my opinion, much more important, is the fact that we can have no thought processes going on but still have emotional signals firing off from our core emotional midbrain. The problem, in my opinion, is that because these are unconscious, we don't know they're happening, we therefore quite often don't deal with them. So what starts to happen, if you imagine a young baby, babies cry, they can't have any thought because they have no language. Therefore their core emotional midbrain is producing a signal which goes straight to the intelligent thinking left hemisphere of their brain, their left cortex, and they produce a behavioural change such as crying, laughing, etc. So that would be what I call a healthy pathway. Unfortunately, throughout our life, due to society and many other factors, we start to almost suppress these emotional signals. Usually because we don't know they're happening, but also because life produces situations that are out with our control, and therefore we don't respond authentically to these emotional signals. For me, what then happens is we start to develop an unhealthy neural pathway, which at some point strengthens itself until it impacts itself on the hypothalamus. And as you'll see from the other video, it's through that overstimulation of the hypothalamus, through the pituitary axis, the lateral medulla, into the autonomic nervous system, and its effect on the immune system, that people then go on to create the conditions of chronic fatigue syndrome, ME, and fibromyalgia, for example. Now the whole Mickel therapy process in a nutshell is designed to train an individual to start to be able to translate their symptoms back to the core emotional midbrain signal that arose, and then coach them in action. So in some ways, and I'm quite often asked this, is it CBT? Well, the answer to that is no, it's not CBT, because we do not work with cognition, which is thoughts. That happens in the left hemisphere. Rather, we teach our clients to translate symptoms back into core emotional midbrain activity, and then coach them through a series of what we call the keys to health in terms of how to respond to those signals. By doing this, what we think happens, although we would need some functional imagery studies to do this, which I pray we get at some point, is that they are then able to weaken the unhealthy, suppressed neural pathway, reduce its impact on the hypothalamus, therefore reduce their symptoms, and at the same time strengthen the healthy pathway that babies have, as I just described, and then eventually the unhealthy pathway is weakened to the extent that they do not get any more symptoms. This is what we think is why Mickel therapy is successful, but of course this is still to be proven. Thank you very much for listening.